In the early 1980s, an unknown health crisis was dominating the headlines.
I remember going to a funeral almost every week. I remember that we didn't understand what this was, and that once posters started going up in the bars and such that talked about this disease that was afflicting all the gay people, it was very confusing. It was very unknown.
Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
The disease was labeled as gay cancer or gay-related immune disease. When it became apparent that the infections were not limited to the gay population, the emerging disease was given the new name, Acquired Immune Deficiency Syndrome, AIDS. Despite the idea that AIDS was a problem happening outside of Colorado, the disease found its way into our community.
My nephew died of AIDS, and then my partner, Paul Stewart, became infected with HIV in 1988 and died in 1990. It's just really hit me right square in the face.
In 1983, our community responded to the growing crisis. The Gay and Lesbian Community Center of Colorado formed a program to support those affected by the disease, and the Colorado AIDS Project was formed.
Colorado AIDS Project was named Colorado AIDS Project because we thought at the beginning that this would be a project and HIV would end.
With a growing disease, CAP became a separate incorporated organization and moved into its own home.
Early when CAP started in the 80s, it was really about community helping community taking care of community. So there was so much ignorance about what HIV was, and so a lot of people were shunned by their families, by their friends, in their workplaces, and in their communities. And so CAP came in at a time when it was really important to have someone there for those folks and to take care of them.
By the mid-1980s, Colorado had more than 100 reported cases of AIDS.
We're getting more and more people knocking on our door who can't find help anywhere else. CAP is their last chance, not one of the chances, but their only and last chance.
As the disease spread and more people became infected, civic leaders, board members, and CAP volunteers worked diligently to educate our population about AIDS. To raise awareness for AIDS in our community and funds to support the number of people who were turning to CAP for assistance, CAP staff and supporters organized a rally and walk. 200 people showed up that first year, and together raised more than $113,000. By the time the 90s arrived, AIDS had become a regular part of our society. Ryan White, who made national headlines with his battle with AIDS and its associated stigma, lost his battle. From this, political leaders took notice, and the Ryan White Care Act changed the way AIDS service organizations like CAP were funded, making it possible to offer more services to more clients. Hollywood was bringing more awareness to the disease, and MTV brought a personal battle against AIDS into homes across America. Locally, activism hit a high with many members of our community, turning out to support CAP's awareness and prevention efforts. Community support hit its stride in the 90s, with a number of organizations producing fundraising events on behalf of CAP. AIDS Walk Colorado drew more than 10,000 participants, including some high-profile attendees.
Life is important, and that we will always stand tall to fight for those people that need our help and assistance.
People have been incredibly generous. I think altogether we will have raised just under $26,000 for the walk.
In the late 90s, AIDS Walk Colorado hit its fundraising peak, raising over $1.2 million. As our world crossed into a new century, advancements in drug therapies made a leap of their own, extending the lives of people with AIDS. A shift in societal attitudes towards AIDS was felt, as were some unintended consequences.
There's a misconception out there that AIDS is cured. So people have become extremely desensitized to it and think they're safe.
As the disease faded from the media and our minds, more people began to turn to CAP for assistance.
In the late 90s is when the medications came out. So we started seeing an increase in clients in the early 2000s. So between 2000 and 2010, we saw about an 88% increase in the number of folks that we were serving. And that was just due to the fact that folks were living longer and they were living healthier.
A growing clientele and funding struggles meant that Colorado AIDS Project had another big shift looming on the horizon, one that would benefit clients across the state and bring 4 of the largest AIDS service organizations together.
CAP had been talking about merging for a very long time. The funders wanted us to merge as long as 20 years ago. The merge happened at this time because everyone was willing to do their part to put the 5 entities together. In the end, only 4 of us decided to merge, but the time was right and we were ready to make the effort to become one entity.
My feeling was we would never get this done, although funders had stepped up and said, you know, we think you ought to look at this and tell us how you're going to sustain yourself. I absolutely was one of those that this was a terrible idea to start with, and slowly moved with all the information and evidence associated with what would be good about a merger, to the point that I thought, yeah, this is the right thing to do.
The merger helped the long-term viability of the organization by costing us less to run the organization. I believe that when you're spending your money on the clients, it does help raise money to support the mission, and it also helps the clients themselves. So by consolidating the administrative functions, I believe that the organization will last.
I think this is not only going to be a very effective, efficient organization going into the future, but also one that it not only stays alive, but gets an awful lot done for our clients and their needs.
The merger has worked out exactly the way that we had planned that it would. And this is going to help us be able to sustain services well into the future. We merged the organization on October 1st, 2011, bringing Denver, Colorado AIDS Project, Western Colorado AIDS Project, Southern Colorado AIDS Project, and Northern Colorado AIDS Project together to become the statewide Colorado AIDS Project. Many of the changes that we're facing we're not even sure of yet. But one thing we do know is that we need to expand what we're doing so that we can remain viable and be here to serve our clients and possibly other populations.
During the 80s and early 90s, we were seeing people who were just living the ends of their lives, and CAP was there to support them through that. But now we're at a time when folks are living. CAP is there to help folks with all of the other aspects of their lives. Poverty, it's access to health care, it's homelessness, it's mental health issues, it's substance use issues, it's prevention. And so we have been able to adjust to the times and what the needs are around HIV.
It's been an amazing 30 years for this organization. We've seen it transition from a grassroots organization responding to an epidemic, a crisis that no one knew how to respond to an organization that was managing care for people with HIV/AIDS.
What would my life be without CAP? I'd probably be dead.
I'm very proud to have been part of an organization that saw a problem and decided to do something about it. I'd like to thank the volunteers, the clients, the board, and the staff for the work they've done for the last 30 years. It's been amazing what they've been able to do to help our clients.
It's just so amazing to see that there were people who at that time were willing to stand up and speak about this issue and to take care of the community. And I think that we're still doing that today. And I think that that's so important, and we stand on the shoulders of those people who started this.